Captain. Hey, come on in. Today, we're going to be doing a endoscopic breast augmentation, and we're going to be using an IDEAL implant. So, what that means is the IDEAL implant is a saline implant that feels more like a silicone gel implant. So we sort of have the advantages of saline, and people that are concerned about silicone don't really have to worry about it. IDEAL is also softer than a regular saline implant, and it was designed in such a way that the saline doesn't move around in the implant. So that's really what it's all about, and this patient has decided that she wants the advantages of that kind of implant. So we're going to get started here in just a little bit. The procedure is going to be endoscopic, which means it's going to go in under the arm. There'll be absolutely no scar on the breast at all, and that's a nice advantage of having this endoscopically. The procedure takes about 45 minutes, 30 to 45 minutes, and then she'll be able to go home. So come on in, we're going to sort of get ready and get started, okay? A lot of people wonder about the IDEAL implant and how it got developed, how it happened. And what happened was a surgeon in Dallas was riding on an airplane, and he had a glass of ice water in front of him, and when they hit a bump, his ice water didn't spill and the guys next to him did. So he realized that if you had a baffle and saline or water, it didn't move around as much. So he built an implant that actually feels much softer than a regular saline implant because the saline doesn't move around too much. And so now we have it. It's called the IDEAL implant. It's been very successful. A lot of ladies really like it. It has a nice shape, and it can go into a really tiny incision. And that's the nice part about the endoscopic approach, is there's not going to be any scar anywhere on her breast. So we'll get started here in just a minute, okay? This is our endoscope, and with the endoscope, we'll be able to come in with very tiny little incision, put the implant in place. I'm going to show you how small this incision is today, okay? So this is up in her armpit. We're basically going to put a small incision right there. And that's the only incision you're going to see. There won't be any incision at all on her breast. This is the IDEAL implant, and you can see it's got a specific shape to it. So it sits on the chest wall and has a nice round, smooth shape like a breast. It has a port here. We can put the saline in on the front, the saline on the back. It has two lumens on the inside where the saline goes, and then on the inside it has the baffles to keep the saline from moving around. So it stays soft and feels soft. IDEAL implant. Okay, all done with the IDEAL implant. And we'll be posting some more information about this on our website and on our blogs. And if you're interested, just give us a call. Thank you.